Schizophrenia is a word that scares a lot of people. The movies paint the picture of a person out of control, someone who hears voices. Dr. Craig Siemens, what is schizophrenia?
Well, schizophrenia is an illness that usually begins in the late teens or early 20s and is characterized primarily by having either hallucinations or delusions. So people gradually develop over time a difficulty with hearing voices that seem very real, that they have trouble differentiating from their everyday experience, or delusional thoughts, which are actually beliefs that are fixed in their mind that things are happening that really aren't. That typically could be things like paranoid thinking, undue suspiciousness, feeling people are out to get them or harm them. And the primary problem is that it's really difficult for them to distinguish those thoughts from reality.
So they may not know they have a problem, but obviously those around them have figured something out. How do you spot it?
Well, typically there are prodromal symptoms, so before they actively develop hallucinations or delusions to a significant degree, they usually have negative symptoms when they're younger. So that would be things like disconnection from people around them, a tendency to be isolative or engaged in their own thoughts, not interacting well with others. And early descriptors of schizophrenia way back in the 1900s called that autism, so kind of similar to what we would think now as somebody that has autism spectrum disorder, that they just don't connect well to other people, they're engaged in their own world and don't interact much with others. They oftentimes have oddity of speech, where you might try to carry on a conversation and their responses don't seem to have any connection to the topic being discussed. They seem random or out of place, and those symptoms are often there first before the active hallucinations or delusions begin.
When does it first become apparent? Is there a certain age that it shows itself?
Typically it's in teens or early 20s. It's a little bit earlier in males than females. The incidence in males and females is about the same, but the onset is perhaps 3 or 4 years earlier on average in males than females.
So how common is it, and what causes it? Is it a genetic link?
The incidence is about 1%, and that's cross-cultural, so that's been shown in virtually every society that the incidence is 1% or so. There definitely is a genetic component, because if you have a strong genetic relationship to a relative that has schizophrenia, then your chances of having it are greatly increased. So for example, if you had an identical twin who'd already been diagnosed with schizophrenia, your concordance, or your likelihood of having the illness yourself, is in the 40% range. If you have both parents who have schizophrenia, then again your incidence is somewhere in the 40% range. If you have a sibling that you're not identical to, but just a sibling, your incidence is about 8%. So far greater than randomly in the population, which is only 1%.
So know your family history.
Yes.
So how do you actually diagnose this, and what are some of the treatment options available?
The diagnosis is really based on a symptom checklist, and also being certain that those symptoms have been there for an extended period of time. So again, the primary symptoms being hallucinations, delusions, oddities of speech, social withdrawal or autistic behavior. And if you have all of those symptoms and a pattern of those symptoms over time, greater than 6 months, then that would lead you to that diagnosis. The differential diagnosis would include things like depression associated with hallucinations, which can occur. That's about maybe 10% of depressive disorders. But that's a little different in that in depression, the hallucinations tend to be mood congruent. So for example, a depressed person might hear a voice, but the voice often would be saying things that fit with the depression. People don't like you, the world would be better off without you, things that are concurrent with being depressed. Whereas in schizophrenia, the hallucinations tend to be more random. odd comments, peculiar observations, self-referential thinking, looking at the television and thinking they're speaking directly to you or giving messages that are intended for you only. So the quality of the symptoms is different.
And treatment options?
Treatment, I think, is a combination for sure. Medication, that's a lifelong need, but also having a structured support system is very important. So bringing the family in and educating them on the nature of the illness and how to respond to it, I think, is really important. So it's very difficult to do, I think, as a family member, but learning that you really can't argue the person out of having their symptoms is very important. So if the family can learn to be calm and understanding of the symptoms and repeatedly pointing out to the person that they're having those symptoms because of an illness, that it's not something that's actually happening. But the ability to just stay calm and accept what the person is saying seems to be really critical. And then secondly, having a therapist, I think on a regular basis, either in a group setting or an individual session, is really important because it helps the patient to stay grounded and remember this is an illness, and being constantly reminded that these things aren't really happening and they are symptoms that the patient can gain some control over by utilizing their medication or utilizing things the therapist has taught them to combat the symptoms as they occur. Makes a big difference.
So it's work, but it can be managed.
Yes.
All right, Dr. Seaman, thank you very much.
You're welcome.